Hello, and welcome to the Ovarian Club, a glimpse into conversations between two besties across countries, South Africa and France, tackling the trendiest women's wellness topics through a scientific lens.
Join me, Dr. Tarryn, and health expert Emma as we explore delicate subjects related to the women's health space.
We started this podcast to share our conversations to help navigate the complex women's wellness world. We hope you enjoy the podcast and take away as much from it as we've enjoyed making it.
The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. So, my follicle friends,
let's begin.
Comment ça va, mon amour?
Good. I feel like the picture of women's health and wellness sitting here. I am strapped up to a 24-hour ECG machine. So they found some premature ventricular contractions in a previous ECG. I was having some heart palpitations and they found some things. Everything seems normal, but I have to be monitored for 24 hours. And what's super interesting, I mean, thank God everything's okay, nothing too serious, other than that I have like wires all over me and whatever. But the interesting fact is that they said that this may be linked to my PCOS, so that hormones could actually have a impact on my heart palpitations, on your heart functioning. So very, very interesting and ties very nicely onto our previous episode.
Well, one thing I must say, Em, is that this is a very rare complication. I have never encountered it in my clinical practice. However, you and your illnesses, wow, the fact that you got these PVCs never cease to amaze me. If anyone's going to get some rare complication, it's going to be you. So yeah, well done on that. And I'm glad to hear that everything's fine.
Learn to laugh at it. But impact of hormones does bring us on really nicely onto today's topic. And I'm really excited to dig into mom brain and pregnancy brain and understand a little bit more the impact of hormones on your cognitive function, how that changes when you become pregnant, postpartum, what happens to the brain, how does this differ from baby blues to postpartum depression to postpartum psychosis. So excited to dig into the subject. And yeah, just a small disclaimer, I'm not yet a mother, but I have a lot of friends who are and who have really been struggling with what they call baby brain or pregnancy brain or whatever it is. And it's such a term that makes it sound so diminished, and what they're going through is so real. And we're here to unpack a little bit more of the science behind it and showcase how it's actually in one way quite a beautiful thing, and in another way just to understand a little bit better how it can impact you and that it is something real. And just really excited to dig into that today.
Yeah, I am too. A very interesting topic, I must say. I absolutely love doing the research behind this. Also, a quick disclaimer from my side is that although I am a qualified medical doctor, this podcast does not serve to offer any personal medical advice. So always seek the advice of a healthcare professional with any questions you may have regarding a condition or treatment.
Thanks, Tara. So with that, can we explain a little bit in medical terms from a scientific standpoint, what is mom brain? I mean, people know it as just being forgetful, not knowing where you placed your keys, not knowing, what's in the fridge. But let's break it down a little bit. Talk a bit behind the science. What happens?
Well, when I was researching the subject, I was really surprised that this topic was neither addressed to me as a doctor in training, nor seemingly spoken about in society as a whole. And I really had to dig into the studies, to learn that pregnancy indeed renders substantial changes in the brain's structure, primarily with reductions in the brain's grey matter volume. So the grey matter is a part of the brain that plays a role in memory, cognition, verbal recall. Now, why this area shrinks, we actually don't fully know, but it's thought to be suggestive of a larger adaptive process serving a mother's transitions into motherhood and enabling her to manage the new and demanding tasks that motherhood essentially poses. This is accompanied by similar reshaping of the amygdala, which is the emotional center of the brain, which also functionally adapts to make a mother more emotionally in tune to her baby. So these brain changes undoubtedly account for the mom brain phenomenon, which is very real. Follow-up MRI studies are now demonstrating that these adaptive brain changes can last up to 2 years postpartum, But this is a highly nuanced subject, and furthermore, robust studies are yet to determine the impacts of these structural brain changes, whether this reverses, as well as the cognitive effects that this has in the long term. And I must say, the data is currently conflicting. One accepted consensus is that while these brain changes may lead to temporary cognitive deficits, which is also, by the way, influenced by fluctuating hormones limited to the peripartum period, the increased cognitive load of motherhood is actually thought to promote late-life cognitive reserve. So potentially strengthening the brain's ability to resist decline in later life. Overwhelming to think that the brain shrinks.
It is
right?
insane to think that. I've also heard that empathy also reduces to other people so that you can focus your empathy on your baby, which is phenomenal, right?
Yes.
So, I mean, I think it's just like this diversion of attention, right, from others and the emotions and everything that you may feel for others starts getting diverted to be able to become more attuned, as you said, to your baby. But that's wild that like there's such extreme changes within the brain during pregnancy.
Another interesting phenomenon that occurs is that of synaptic pruning, which is a mechanism whereby neural connections, which are deemed unnecessary, are diverted. So it's like almost like the brain switches off unnecessary processing and turns on neural connections that need to be hyperstimulated to attend to the baby's needs.
Like what, for example?
So, for example, verbal recall, social cognition, memory, all of the unnecessary processing gets shut down in order to be emotionally heightened to the baby's needs.
That's amazing. That is, it's insane.
Evolution.
Then on top of it, you have hormones, right? So on top of it all, you have these huge hormonal changes within the body that also plays a great role in shifting your emotions, what you're feeling, your bonding with the baby. So can you break that down too?
Mm-hmm. So in addition to the neural structural changes that happens in the brain, hormone fluctuations also occur, and these are great contributing factors. So what happens is estrogen and progesterone, two very key hormones that drive pregnancy, are rapidly decreased in the postpartum period. Estrogen, I would say, remains mildly elevated to some extent, and this facilitates breastfeeding, but the progesterone rapidly declines. And with this rapid decline of these hormones, mothers can experience symptoms of brain fog, confusion, even irritability. In addition to those two hormones, there's also oxytocin, which is the bonding hormone, which is also increased, or it's very much increased in the laboring process because it facilitates uterine contractions and then subsequent breastfeeding. But it remains persistently high, especially for mothers breastfeeding. And the cortisol, which also subsequently rises, especially in the laboring process. This all contributes to stress and memory challenges in the postpartum period.
Sorry, just to kind of almost sidebar a little bit, but something that you were saying around the progesterone and estrogen decrease and that causing, the brain fog and everything like that, just for kind of as someone who doesn't have kids yet, is that kind of comparable at all to what happens maybe in PMS?
Yeah, for sure. The menstrual cycle, women are also very prone to hormonal fluctuations in the luteal phase, which is the second half of the menstrual cycle, that can also precipitate feelings of irritability and bloating. But yes, that is due to the hormonal fluctuations that women experience. And also, I just want to add that it's not only women who experience these hormonal fluctuations. Men do too, to a lesser extent, of course. But studies have also illustrated that male caregivers, they are very sensitive to hormonal fluctuations as well in the form of testosterone. So studies have illustrated that testosterone levels are dramatically decreased in male caregivers, even if it's not their biological child. And this is because testosterone is considered the macho hormone. And when the levels are decreased, males are more prone to the baby's emotional needs, and they're softer, they're gentler. They really do assume that caregiving role. And this is because of this drop in testosterone. It is an evolutionary mechanism.
That's super interesting also with regards to the evolutionary factor. I did actually come across this one TED Talk that was explaining a little bit mombrain, also explaining that postpartum, you sometimes have these intrusive thoughts, and a lot of women have intrusive thoughts. And it can be very scary. From an evolutionary standpoint, it's very interesting because these are like warning cues for you to take care of your baby. Or like, for example, in this TED Talk, they were explaining that it's really sad, but there are these monkeys in Japan and they go into these hot baths, and the first time mothers, they will jump into the hot baths with the baby on their back. And very tragically, the baby dies often because it drowns. And the second time they're a mother, second time around, they don't make the same mistake. So they learn from their mistake. But in humans, we have these kind of warning cues and these evolutionary factors so that you can take the best care of your baby. And that's pretty amazing. And I thought that was also quite a beautiful way to rethink these, mombrain, all of this, and just the evolution behind it to better equip you to be the best mom or dad or caretaker that you can be. So I think that's pretty wild.
Yeah, that's a very interesting study. But yes, I wanted to say that although hormonal fluctuations play a big role, as do the brain shifts neurostructurally, what else has a huge role to play is sleep deprivation.
I think so many people just dismiss mombrain because they think it's just sleep deprivation, right? So definitely a question I wanted to ask you with regards to how is sleep linked to all of this?
Yeah, so sleep deprivation impairs memory, focus, decision-making abilities, and leads to emotional dysregulations. Already mothers are susceptible, and fathers now we've learned, but already both parents are susceptible to all these hormonal shifts. And now with the lack of sleep, everything is heightened. So definitely a contributing factor. And unfortunately, nobody is immune to sleep deprivation in the postpartum period. I mean, babies need to be fed on the hour, like babies crying constantly. Like it's not an easy time for new parents.
And I think sleep deprivation also comes with feelings of depression or feeling down, or it can bring sadness on, feelings of being lost. I would love to kind of divert a little bit and understand mombrain, baby blues, postpartum depression, and then postpartum psychosis. Sleep, I'm sure, is a big underlying factor in it all. But taking a step back, looking at mombrain versus baby blues, can we just touch on that? What is baby blues, and understanding, also how much does the hormones have a role to play?
So mombrain is basically experienced by almost 100% of the population. Nobody's spared, right? The brain will shrink in size, even if it's by as little as 3%. The difference between mombrain and baby blues, tongue twister, baby blues. Baby blues is a temporary emotional condition, right? So it peaks 2 to 3 days postpartum and it lasts up to 2 weeks. Whereas mombrain actually can occur throughout pregnancy, but it's typically heightened in the third trimester. And then it can persist, those symptoms of forgetfulness and lostkopness, as we call it in South African Afrikaans terms.
So with baby blues, then that's that drop from the progesterone and estrogen postpartum after giving birth, and it's a temporary thing, 2 weeks. I imagine sleep also has a massive aspect to play in it, but also you're flooded with all these different hormones and everything. Let's talk a little bit also then around postpartum depression. How does baby blues, mombrain, how does that differ from postpartum depression? I think a lot of moms also struggle a lot at the beginning of motherhood because it's a new identity. There's a kind of identity crisis. Who am I? Who's this new role? What do I actually want in life? What do I want from work? What do I want with this? Sleep deprivation, all of that on top of it, mombrain, forgetfulness, whatever it may be. Where does that start slipping into postpartum depression, which is much more serious?
Right. Yeah. So postpartum depression is a very serious mental health condition. It's a mood disorder. And basically all the symptoms that I alluded to with regard to baby blues, they're just way, way more exaggerated. It really affects the woman's ability to function and bond with her baby. And the key distinguishing difference between baby blues and postpartum depression is that with postpartum depression, it continues after the 2-week period when it would be deemed baby blues and then persists up to a year postpartum, although studies are a bit inconclusive because it can actually persist for longer than a year. There's no well-defined period, especially if it's not well managed. But for all intents and purposes, let's call it 2 weeks postpartum up to a year. And it can have really devastating effects on the mother, on the baby, on the family. And it is absolutely something that needs to be spoken about, because 1 in 7 women suffer from postpartum depression. Sometimes it's mild and it's transient and it goes away without treatment or just a little bit of psychology. But in a lot of cases, it's a little bit more serious and needs more assistance.
Medical intervention or...
Yes. Yeah. So in the case of moderate to severe symptoms, it absolutely would warrant both psychology and medical review. At the very least, I'd say if one is experiencing symptoms, one should absolutely consult a healthcare professional who can then perhaps start the patient on an SSRI, like an antidepressant or anti-anxiety medication, which is, by the way, safe to give in breastfeeding, because they say that the benefits to the mother and the impact that this can have on bonding and whatnot, this outweighs the potential risk with regard to medication spreading through the breast milk. So the risk is so negligible that it's almost shouldn't be taken into consideration, and medication should be given.
And 1 in 7 women, that's a crazy statistic, and I think so many people are just not aware of this, or they just boil it down to being fatigued or being a first-time mom or whatever it may be. But it's very crazy statistic how common that is. Yeah. And understanding a little bit more around like the hormones and what happens in the brain, how does that differ from what happens in mombrain or just in baby blues? What else is happening? Are there other underlying factors that could contribute to postpartum depression, and understanding that a little bit more?
So I would say that in the case of postpartum depression, those structural brain changes most definitely occur. But in addition to that, there could be an underlying genetic factor. And these genetic predispositions switch on genes that's called epigenetics at the end of the day, where our environment dictates the upregulation of certain gene expression. So certain genes are switched on. This causes chemical imbalances in the body. And I would say this is what drives postpartum depression, these chemical imbalances in the brain, PPD more,
so
postpartum depression.
So if, for example, you have in your family a history of postpartum depression or any mental health disorder, trauma, I would imagine, also plays a precipitating factor in that.
Other risk factors include lack of social support, added life stresses. Maybe the mother's lost her job just before giving birth. I mean, this can really add to the stress burden. Low socioeconomic status is considered a risk factor for the development of postpartum depression. And also younger parents, younger moms. It is more pronounced in younger moms as well as single parents. But that's not to say that older moms and women that are happily married won't experience this. Sometimes they can really catch you out, and you're not known with a history of mental health conditions, and then suddenly, wow, you're just whacked in the face with symptoms of worthlessness and depression and anxiety, and it's really affecting your ability to function. And this is going on for 2 weeks. Then you really need to seek the help and support that you need.
Absolutely. And to enable that, going on then kind of further down, there's also postpartum psychosis, right? And not to scare anyone who's listening in, I've heard this is a lot more rare. You can speak more to that, but maybe we can touch very lightly on, not that it's a light subject whatsoever, but on postpartum psychosis and what happens there, and maybe just lifting the curtain also that this isn't something that the person's just really like something wrong with them. It's this chemical and hormonal and neurological change that is happening.
Yeah. So as you said, it's very rare. So they say 1 to 2 per 1,000 mothers. So first, one should ask ourselves, what is psychosis? So psychosis is a disturbance in an individual's perception of reality, and it's characterized by 4 key traits. There's delusions, which are fixed, false, idiosyncratic beliefs that are not culturally based. There's hallucinations, which are sensory experiences without physical sensory stimulation. So, for example, one could experience an auditory hallucination where a mother's hearing a voice that's not there, the voices instructing the mother to kill her baby, infanticide, right? They could be visual, mothers seeing demons in the room and reacting to that. Then there is disorganized thought and disorganized behavior. So yeah, I don't know if you're familiar with the Lindsay Clancy case.
Have heard of it, but not the specifics.
Yeah, so the most recent one that crossed my radar, 32-year-old nurse from Massachusetts in America, and she was charged with murdering her 3 young babies. It was a tragic case. She strangled her babies and then proceeded to attempt suicide. Fortunately, she did not die. But what's remarkable about this whole case is that her defense, including her husband, has rushed to her defense, suggesting that she was suffering from a severe case of postpartum psychosis, and she is not a danger to society. She's actually a victim of a very serious mental health disorder. The case has drawn attention to the stigma surrounding mental health issues in mothers. So important to talk about.
No, absolutely. But is postpartum psychosis, like postpartum depression, something that's time limited? Is it time bound? Or is it something that, there are permanent changes that happen in your brain, or triggers permanent psychosis?
So like in the case of postpartum depression, it's very rare that this would happen in the first 2 weeks, something so drastic. So it takes a while for the chemical imbalances to kick in and can persist for up to a year. But in the case of Lindsay Clancy, I think even her youngest child may have been 2 or 3. So in her case, she was just not treated. So the psychosis can continue if it's poorly managed.
And I think that...
And PPD, postpartum depression, can also persist into a generalized depressive mood disorder postpartum if it's not treated.
And I think when we were discussing this topic a little bit and preparing for this discussion, you also mentioned that when you were in medical school, and I think that was something that really has stuck with me. You were in medical school, and when you were working in an obs and gynae world, this was not something that was necessarily spoken about, or the mothers weren't briefed about these things. And I just find that really, postpartum depression impacts so many women. Thankfully, psychosis impacts very few women, but the fact that these are not spoken about in society, how can we better equip ourselves to have these conversations, that we take care of mothers in our society, and that they're not struggling and facing these things by themselves, and that it doesn't end up in these catastrophic events like children being killed. I mean, it's devastating. I mean, that's obviously an extreme, but postpartum depression itself is also just crippling.
Yeah. At the end of the day, it really does come down to lack of awareness, I believe. And it's absolutely shocking that although I was taught about this in my psychiatry block, what is postpartum depression and what are all the psychiatric illnesses, it was really alarming that we didn't really implement this in practice. I think there is a good enough reason to account for this, and that is that typically we would discharge mothers in the obstetric ward day 3 post Caesar, or day 1 post NVD, natural birth, sorry. And it would be counterintuitive to screen for this so early, because it typically kicks in 2 weeks post partum, right? The symptoms, or at least the diagnosis of PPD due to its chronicity, or 2 weeks duration. But at the end of the day, it still should be spoken about, and at the subsequent postpartum appointments with a healthcare provider, when babies are being reviewed by the clinical nurses or a doctor or a pediatrician, whatever, we should be screening for these symptoms, and we should be speaking about it. I'm not pointing fingers at any healthcare workers. I believe that we're all poorly informed, and we don't know what to screen for, and it's due to limited awareness. It's due to mothers themselves feeling disempowered because they think, oh no, this is normal. I'm not going to speak my symptoms because I'm actually fine. So there's that. And what can we do to reframe this is just address it, to talk about it, and to reach out to women that we believe are struggling and assist them with the help that they need. Guide them towards a healthcare practitioner who can properly assess and treat if necessary.
And hopefully if women also understand ahead of time these different symptoms, from mombrain to baby blues to postpartum depression, and understand that a little bit better, they also understand what's happening with them and can also assess whether, hey, this is normal, intrusive thoughts, for example, can sometimes affect a lot of women just because of the mombrain setup, whatever it may be, or, forgetfulness, losing the keys. But maybe, hey, if I'm feeling very depressed or detached or whatever it may be, and this is prolonged for a long period of time, maybe I need to go and speak to a healthcare professional and not just diminish it to sleep deprivation or being a new mom and being overwhelmed, as I'm sure so many people too.
Yeah.
I would love to.
Just to allude to some more symptoms, just so that everyone's aware. In the case of PPD, there's diminished pleasure, so anhedonia. So the world is in black and white. There's no color. They feel depressed. They feel worthless. They have recurrent thoughts of death and suicidality in extreme cases. Psychomotor agitation or retardation. So what that means is either they can be very, very restless or very, very slow. So these are all symptoms to look out for when we're addressing PPD.
That's really helpful to understand. And one of the things I would love to also chat about, kind of pivoting a little bit the conversation, is breastfeeding. And what is the impacts of that? From my understanding, breastfeeding is a beautiful and wonderful thing that can help you to further bond with your baby, but it is also exhausting. You have to create the milk, you have to give the milk. That often means that you're getting up more during the night to feed your baby, as opposed to maybe delegating and sharing that responsibility with your partner. Can we talk a little bit about that and breastfeeding? What is the medical opinion on breastfeeding? I feel like it's quite a heated topic because people love to have very strong opinions on it, and there's a lot of judgment around breastfeeding. So, but from a doctor's perspective, what are your thoughts on it? Especially in these different...
From a doctor's perspective, breastfeeding is actually deemed a protective factor against PPD. I know that sounds counterintuitive because it almost seems like it can contribute to anxiety and whatnot, but it actually, if a mother gets it right, it's really beneficial, not just for the baby, but also for the mother. And there's absolutely no judgment for mothers who are really struggling and who can't produce the milk. I mean, we see you, we hear you, you're trying your best. But at the end of the day, if you can breastfeed your baby, it is immensely beneficial. I mean, also from a cognitive standpoint, it's very, very healthy for the brain. And women who have breastfed in the long term have demonstrated enhanced cognitive abilities in the future. So that is the medical opinion. But I do hear you, Em, and I know it can be really difficult for mothers, and there's no blame if you can't breastfeed. But if you can, it is definitely an added perk.
My understanding, I mean, just again to reiterate what you're saying about no shame or anything and not being able to, because I think there's so much pressure in society to breastfeed. And imagine the mom is also to your point, there are so many added benefits of breastfeeding. But I think from what I've understood, it's quite common too that baby doesn't latch or the mother is not able to produce sufficient milk, etc. So just to kind of highlight that aspect that, mothers who can't breastfeed, it's not that they're failing as a mom or something. Because I've also heard from friends and listening to some talks, etc., that, moms, also new moms especially, also have this mom guilt.
Yes, and which is probably why not breastfeeding would be considered a risk factor for postpartum depression, right? Because then a mother feels guilty and it adds to the feelings of worthlessness. So, yeah, but it is a real struggle for some mothers, and I do feel for them, and they must know that there is definitely support. They can go seek a breastfeeding specialist or any healthcare worker, even a doctor can show mom how to help the baby latch properly. And sometimes it's the case that just no maneuvers can help. Baby just does not take to the breast, and that's also okay. Maybe the baby's got feeding difficulties. There's conditions in the baby's mouth that prevents the baby from latching properly. So definitely get it evaluated and get it checked out.
So I also just kind of want to close on this and talk about what resources are available for women who are going through this. And are there places that you can go and seek out help, or what is available for moms?
So I'm glad that you raised this question, Em, because when I was doing some research into this topic, it probed me to do some deep digging and search for the resources. And I was absolutely alarmed to learn that there is just so little out there. It took me down a whole rabbit hole. I was busy calling all the helpline numbers. Nobody was answering. So I was like, okay, erase. We won't promote this NGO. Where it was a real struggle. But at the end of the day, I have come up with 3 helpful hotlines. And this is for our South African audiences. The first one is the SA Depression and Anxiety Group, otherwise known as SADAG. And their call number is free of charge. It's 0800 567 567. Then I also contacted a lovely lady in KZN. Her name is Alex, and she works for the Mom Support Network. They're actually an NPO, and they're a community of mothers. It's a community organization of mothers for mothers. They're not qualified professional counselors. They're just there to offer support because a lot of these women have experienced PPD and they've come out on the other side and they've got very helpful tips to share. Then there's also Melissa from Aluz, ALUZ. I chatted to her as well. She also confessed that she didn't know where to turn. There was just nothing there. And this prompted her to start her own little organization, and she offers one-on-one online sessions. But I think the take home from this is that, when you're pregnant, even pre-pregnancy, familiarize yourself with the resources around you. Familiarize yourself with the symptoms, look out for them. And this is not just for mothers here, fathers as well, parents, family members. Everyone must know the signs to look out for and when to prompt the individual to go seek professional health care. Yeah, learn which organizations operate in your area. If you're tuning in from France or England, America, we've got listeners in India, wherever you are in the world, know that there is support available. It's just a matter of finding the right fit for you.
And I think to end also on a positive note and just kind of summarize what I've heard, mombrain, these changes that happen in your brain when you're a new mother, it sounds really scary. And I hope that that's not the takeaway of this episode. It sounds, especially as someone who's not yet a mom, it can sound a bit like daunting and everything, but there's also something really beautiful in it, right? It's all these changes to really make you attuned to your baby. I heard amazing stories about moms in a room full of crying babies can pick out their baby's cry, or they can understand exactly what each little cry means, whether they're hungry, whether they just need to be burped, whatever it may be. That's quite amazing too, what the human body can do to better attune us to be the best moms and also best dads or caregivers out there. So I think there's also a way to kind of reframe this and almost be thankful for these changes as opposed to kind of just shove them away and be like, this is terrible. And again, it's coming from someone who's not yet experienced that. But I do think that is also important to open up these conversations and shed light on it and also see some of the beauty in that.
Yeah. Absolutely. And so I always tell new mommies at the end of the day that this really is your superpower. So I know you might be feeling completely all over the place, but at the end of the day, your brain is adapting. And if you are slightly more emotionally sensitive to these hormonal shifts and brain structural changes, then this is just because evolution is priming you to be a better caregiver at the end of the day. It's also really super common, as we've illustrated from this chat. So you're not alone. A lot of women are going through this. It's not in your head, and support is there. So know the signs, recognize the cues, and get the help that you need if you are struggling.
And I can only imagine how tough it must be. And it is one of the hardest jobs in the entire world. And just hats off to all the moms and dads and caregivers out there, because that is one heck of a job. And also, thank you so much for tuning in. Please don't forget to subscribe and to follow us on @theovarian_club on Instagram. And we are so excited to come back. We're going to have a really nice lineup of new episodes talking about egg freezing, fertility treatments, skincare, all the hottest topics from a scientific perspective. So thanks again.
We're looking forward to seeing you next time. The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. See you soon, follicle friends.